of our four speakers, Nancy Sasaki. And Nancy, we were talking earlier, has spent, you can come on up, spent 29 years with Planned Parenthood, a little bit of time with ACLU, but basically Planned Parenthood, not only in San Diego, but in Los Angeles, Riverside County, Hawaii,
and Austin, Texas.
And Austin, Texas, where you started.
Yes, that's exactly where I started. Texas Longhorns, y'all know this?
Very good.
All of y'all.
But has come here and was actually, after the conversation with Nick, you were the first person who was recommended to speak by one of our San Diego members, is Rob McRae, who's the chairman of the Alliance. So we're going to hear a lot more about the Alliance, but now you know a little bit more about the person who's going to share it with you.
Thank you so much.
Thank you.
Thank you, everybody. Oh, where's that major technology piece that I got instructions on? Yes? Okay. Thank you, everybody. I'm really honored to have been asked to be a part of this. I'm going to give you a little bit of an overview of what Alliance Healthcare Foundation is all about. Press this button. Oh, y'all already know me. Okay, so I'm going to give you an overview of what Alliance Healthcare Foundation is doing, as well as kind of an overview of San Diego philanthropy, just so you have an idea of what our challenges are, and then what we specifically are doing to improve the health of our community. So this is like the, who are you going to call when you need money? Most of the nonprofits call individual donors. They're calling government, and they're calling foundations and corporations for funding. It's kind of the typical places that they go. Can you all see this very well? This is from the University of San Diego, USD, a study that they did in looking at philanthropic giving in each of the major in some of the major communities across the country. And compared to other locations, San Diego falls very short in terms of foundation grant dollars that are available per nonprofit in the community. So San Diego here has $34,000 per nonprofit in our community, compared to San Francisco, that has $297,000 per nonprofit. That's per nonprofit. And then you'll see over there in Tampa, they're really weak. They have $10,000 per nonprofit. But that's the challenge, right? We don't have the kind of foundation dollars here in San Diego that are necessary to really support and have our nonprofit organizations thrive. So for us, if you look at what we would be able to do in San Diego County, we have about $68 million in the bank. We were funded by a healthcare conversion, which meant that when the healthcare plan went from being not-for-profit to for-profit, they were required to set aside dollars to continue to serve the community. And these are the dollars that we continue to work with. But there are about 750,000 people in need in San Diego County. So if we were to just empty our bank, everybody would get $91. It's not going to go very far, and you're not going to change the health and wellness of people in the community. So what are you going to do? One of the things that we do is our innovation initiative, and this is really a lot of alignment with what you were talking about earlier, Mimi, in terms of technology, although it's not always technology. This is what we do. So our issues are around advancing health and wellness. We look for innovative approaches, and we are focusing on the most vulnerable populations. These are people under 250% of poverty, those who are uninsured or underinsured, the children and homeless as very vulnerable populations. Our grants focus on supporting nonprofit organizations that advance health and wellness. We started this initiative in 2010. We were actually back then looking at what were organizations going to need to do in order to prepare themselves for the day we're at right now, when ACA and Covered California come into play. What needed to happen back then to prepare for now? We wanted to be able to move the needle and improve and make more efficient the healthcare system. That was in 2010. That was our hope. We're still hoping to improve the healthcare system. But we do this by funding those innovative approaches to serve the most vulnerable populations. These are the organizations that we've funded since 2010. In 2010, we funded 2 organizations, Text for Baby and 1E App. We distribute $1 million each year. And this $1 million was split between the two organizations. Text for Baby was actually an opportunity to look and see whether or not text messaging would be a way to get women to get more information about their pregnancy, about the development of their baby, and what they could do after the baby was born to have a healthy baby. Barbara Mandela is in the room right now, and she was very integral. When I came on board, she was the person that was leading this charge with Text for Baby and really getting the enrollment up and getting people in our community to know what Text for Baby was all about. So thank you, Barbara. One app is an opportunity for us to look at having all of the benefits in one system. Great idea. So you have everything from food stamps to CalFresh which is CalFresh and food stamps, the same thing. You know, it's all there. But also the tax benefits and everything are in there so that a family can go in and see for all of the benefits that they might be eligible for. And we brought that system to San Diego and continue to work with it. We're hoping that 211 San Diego will continue to be the champion of this particular project here in San Diego. The CIE you're going to hear a lot more about. Well, you won't hear a whole lot more about it, so maybe I better talk about it. CIE is the Community Information Exchange. Our Executive Director, Scott Bechtler-Levin, is here. Raise your hand, Scott. Thank you. And this was a project that we funded in 2011. This project is, you know, a lot of people know about the Health Information Exchange, and you will hear a lot more about that. That's Dan Chavez right here. But and they're looking at bringing all the hospital information and medical information together. This great group of people came together and said, what we want to do is connect all the social service information. Can you imagine if you went to your doctor and you're somebody that's in the vulnerable populations, and their doctor looks at you and has no clue where you were, where you spent the night before, has no clue whether or not you've used other hospital systems, has no clue whether or not you've been in substance abuse or mental health facilities, but all they have is that medical record in front of them. HIE is going to connect them to the other hospital information, but they don't know what else you've been to. So if they need to refer you to a case manager, they'll start all over. They'll send you to a new case manager. That new case manager works with you, has no idea what your history is. So the CIE wants to bring all of that information together. And their first use case is going to focus on the homeless population so that we can really track and better serve them in our community. Last year, we funded UCSD, and this is a project called WAT, which is the Wireless Observed Therapy. There's a company called Proteus that has developed a system, an ingestible sensor. You actually embed the sensor in the medication. When you take it, it separates from the medication. It sends a signal to the patch on your stomach that sends a signal to your cell phone that sends a signal to the doctor that says you took your medication. And they just started trials and implementation this month, where they are looking at tracking all of the TB patients in our community. Because we know we can cure TB if somebody takes all of their medication. We know that we can reduce the public health risk if somebody takes all of their medication. And we know that we can avoid those antibiotic-resistant bacteria by taking all of your medication. So that's where we're starting to see whether or not this ingestible sensor is a great opportunity for making a difference in this particular disease. And then this year, we funded Access Youth Academy, and their executive director, Renato Pava, is here with us today. And this is a real change from the stuff that I've explained to you before, which was had a lot of technology involved with it. This is really the thing that excited our board, was that this is a project that begins to look at the community as part of the health system. And how can we benefit young people through sport activity, through the game of squash, getting them into college, getting them coming back to the community and making a difference in their community. Because once you've gone to college, your kids, the families, the kids after you have a higher percentage of going to college, have a higher opportunity in making a change and making a difference in their communities. So we're excited to be working with Access Youth Academy in this particular initiative. One of the things I was going to say about this as you were talking, Mimi, that it really brought to mind, one of my challenges that I'm going out and telling people that are in the tech world is that a lot of technology and a lot of the apps that I see out there are all about how do we do this, do good. I think they basically want to do good, but they're really about how do we market this and how do we make money and how do we make a lot of money really quickly. What's really the challenge is working with the nonprofit organizations in our community and the people that they serve, the vulnerable populations, and making those applications and those technologies available to the nonprofit organizations in a way that makes sense. So the sustainability becomes a real challenge. But they are the people who are the most vulnerable and probably in the most need of those particular technologies. So I challenge you guys that are out there that are doing this work to think about them as well. The other $1 million that we give out each year is for mission support. And this is where we're looking at nonprofits that are doing a lot of the innovative things that we like to see. But this is really cooperating. This is saying, we believe in your mission. Go out and do good in the community, build your sustainability, build your capacity, and just do good because we believe in you. It's not about any particular project. It really gives these nonprofit organizations the flexibility to do what they need to do because there's always a new challenge. And they can use this money, which ranges from $25,000 to $100,000 on an annual basis. In 2013, we funded 16 organizations here in San Diego County, and we funded 8 out in Imperial County. What else do we do at Alliance Healthcare Foundation? I've been there for 2 years, so I'm still feeling like I'm pretty new, but we have been doing a lot of convening. We get people together in the community. As I'm out and about, I hear a lot of stuff that's going on, and I'll bring together people that seem to be working in the same field. One of the things that's really funny about being in the foundation world is you'll get these proposals in, and they say, we're the only ones doing this, and you've got 4 of them in front of you. And you're going, well, apparently you don't know these people, and maybe I should help connect you. And that's a really great role that we can play, is to get those synergies together so that there's some collaborative efforts in our community. So we've done one on the databases. There's a lot of organizations upgrading their databases or looking at expanding their databases, creating new ones. And how do we connect all of those? And you'll hear some of that today in terms of how we go for a connected, healthier community. I was surprised when I came on board what the 2 vulnerable populations are, children and homelessness, and I wanted to see where that intersection of homeless children happens and bring those organizations together so that I could learn, because it's a sad fact that the homeless children are increasing in our community. So what are the organizations that were set up to serve adult homelessness doing to better serve the children? Because can you imagine being in a homeless shelter as a child, and you've got the adult men over here and you've got the adult women over here, and the families are in the middle? Because they're trying to keep the families together, but they're not set up to really serve the families. I also did that with domestic violence. The county was giving money to the domestic violence hotline through marriage license fees. Don't ask me. But when the marriage license fees started to drop, the county cut the budget. So there is no domestic violence hotline in our community. But the domestic violence providers wanted to come together and see what they could do to maybe solve this problem. And it's a daunting task that they're still working on. Learning and listening. I go out in the community and I try to get involved. I stick my nose into everybody's business to find out what they're doing so that I can learn about what's happening in the community. Because all of my background in Planned Parenthood really helps me in the reproductive health world, but I had no clue about homelessness. I had no clue about the children. I had no clue about the elder and the senior care that's going out in our community. So it's really great for me to get out there, as well as my program officer, Sylvia Barron. So we're out there learning and listening. And we spread the word. We're doing a lot with social media. My Idea House partner is in the back, Kevin, and he does everything with me with regard to social media. We're on Facebook. You can be friends with us on Facebook. You can like us on Twitter. You know, I got all of that down anyway. But we live stream. We have this month at Alliance Healthcare Foundation where we live stream to whoever wants to watch us. I don't know why. But anyway, we do talk about what's going on in the community. And it really is about others learning about the good work that's going on in our community. We really try to promote all of our grantees on our social media and let them know what's happening. So what's to come today? You're going to hear about some exciting, innovative projects that are happening in our community. The possibility of ultimate connectivity. If you could imagine having the County Health and Human Services, the San Diego Regional Health Information Exchange, 211 San Diego, along with the Community Information Exchange, all of that really connected, and all of that information being available to not only the providers but to the community, where we could do trending and reporting and understanding and learning about our community and being able to develop policies and all. I get really excited about this. I'm talking really fast. Sorry about that. But it's really exciting to think that all of this could be available to us as a community to learn about our health and make a difference. to have access to health and social information at the time of care. You know, when you have somebody that's been decided to leave their home because of a domestic violence situation, and the providers are sitting there calling 4 or 5 different places. Do you have a bed? Do you have a place? Can we put this person somewhere? They're sitting there going, oh great, I left, I have no place to go. I really have no place to go, and I was told this was the place that could help me. That happens in the homelessness world. It happens a lot in our community where we're making, I heard one of our board members was saying that in their project and trying to get people to the services that they need, one nurse can spend their time making 50 calls to find out where that person needs to go. And that's just way inefficient, and we have the technology to make a difference. And I think these organizations are ultimately going to come together and make that difference for our community. The ability to trend data, report on health progress and health needs, make a difference in our community again. And I am going to cede the rest of my time to my good friend and colleague, John.
We are indeed adaptive business leaders. So if you've been carefully following the agenda, you may have seen that we were going to do Q&A immediately following the speakers, but the speakers decided they would prefer to have the 3 speakers, and then we will do Q&A. And of course, we acquiesced. So